Everybody, my name is Nhi, and today I'm going to present on influenza, which is also called the seasonal flu. It's a contagious virus that affects the respiratory system and spread easily each year. I'll go over the symptoms, what causes it, how it infects the body, who it affects the most, and how we treat and prevent it. I'm also connecting this topic to a Christian worldview through Philippians chapter 2 verse 4, which reminds us to care for others. Flu prevention is one practical way we can protect people around us. Starting with signs and symptoms. Influenza usually comes on very suddenly. A lot of people feel fine, but then within a few hours they feel really sick. The most common symptoms are fever, chills, fatigue, headaches, and body aches. On top of that, respiratory symptoms are also very common, such as dry cough, sore throat, a runny or stuffy nose. When kids get influenza, sometimes they might experience vomiting or diarrhea. Most people feel better in about a week, but for some people, the flu can turn serious and lead to complications such as pneumonia or worsening of chronic conditions such as asthma or diabetes. Now, I'm going to talk about what causes influenza. The flu is caused by the influenza virus. The two main types that spread in humans each year are influenza A and influenza B. And influenza A is usually responsible for the larger outbreaks. On the surface of the virus, there are two key parts. HA, which helps the virus to attach and enter your respiratory cells, and NA, which helps new viruses leave the cells and spread to nearby cells. One important thing about the flu virus that it changes a little bit every year through small mutations. That's why new strains keep appearing, and that's also why we need an updated flu vaccine every season. Now, let's talk about the pathogenesis of influenza. Influenza spread mainly through coughing and sneezing, or being close to someone who is sick. It can also spread if you touch a surface with the virus and then touch your face. After the exposure, symptoms usually show up in about 1 to 4 days. Inside the body, the virus attaches to the lining of the nose, throat, and lungs. It enters those cells, makes copies of itself, and spread to nearby cells. That damage to the respiratory lining, along with the body's immune response, is what causes symptoms like fever, cough, and aches. The airway damage also makes it easier for bacteria to infect the lungs afterward, which is why pneumonia is a very common complication of influenza. Next, we're going to look at the epidemiology of influenza. The flu happens every year worldwide, and in the US, it mostly peaks in fall and winter. The CDC reported that during the 2024 and 2025 season, most cases were caused by influenza A strands. Some groups are more likely to get severe illness, like older adults, young children, pregnant people, people with chronic diseases, and anyone with a weak immune system. Also, influenza A can live in animals and like birds and pigs, and sometimes new strands come from those animals, which can lead to bigger outbreaks. Lastly, we're going to talk about the treatment, prevention, and some Christian worldview. Now, for the treatment and prevention, most people treat the flu with basic supportive care such as rest, fluids, and medicine for fever or pain. For people who are high risk or very sick, doctors may prescribe antiviral medicine like Tamiflu, and those work best if taken within the first 48 hours. Prevention is the most effective approach. The CDC recommends getting a flu vaccine every year for everyone 6 months and older. The 2025 and 2026 vaccine covers 3 major strains expected this season. Other simple prevention steps matter too, such as washing your hands, cover your cough, clean shared surfaces, wear a mask if you're sick, and stay home when contagious. From a Christian worldview, all of this connects to serving others. Getting vaccinated and not spreading illnesses to protect the people around you when they're most vulnerable is a real way to live out Philippians chapter 2 verse 4. My sources include Nestor Microbiology along with reliable medical sites such as CDC, Mayo Clinic, and Cleveland Clinic. Thank you for listening, and I'm happy to answer any questions that you have. Have a good Thanksgiving break.